I'm a Healthy Communities Coordinator for the University of Wisconsin Extension Foodwise program. In my role, I'm focused on policy systems and environmental change efforts that support community food and health systems here in Milwaukee and across Wisconsin. I'm most interested in supporting collective action and community partnerships that emphasize the connection between food, health, and other variables like education, housing, economic development, environment, and public safety. With a background in organizing and a passion for connection, I bring folks together to overcome siloed sectors and bring community voice to the table so that residents are leading food systems change. In addition, the multidisciplinary nature of the Bloomberg Fellowship aligns with Extension's priority to bridge disciplines to inform our most pressing societal problems and create community change across Wisconsin.
Hi, everybody. My name is Tessa Mork, and I'm a Bloomberg Fellow studying obesity in the food system from Washington, D.C. In D.C., I work at the YMCA of Metropolitan, Washington. In my role, I work as the Association Director of Community Health, where I oversee our chronic disease programs as well as our SNAP-Ed program, which provides hands-on culinary and nutrition education to over 3,500 SNAP-eligible community members in the district annually. I'm looking forward to this upcoming panel because food and beverage advertising is an equity issue that comes up often in our work and is near and dear to me. Please welcome Emeritus Professor of Epidemiology at the University of Pennsylvania Perelman School of Medicine and Research Professor of Community Health and Prevention at Drexel University Dornsife School of Public Health, Dr. Shiriki Kumanyika. Community advocate and enthusiast, Kamri Moses. Immediate past present at the Maryland Academy of Nutrition and Dietetics, Teresa Turner, and your moderator, Professor and Chair, Department of American Studies at the University of Maryland, Dr. Psyche Williams-Forson. Thank you.
Thank you. Developing effective food policies which promote health and equity requires historical, cultural, and economic perspectives, right? It also involves addressing and confronting systemic barriers to achieving equity, as well as social determinants of health need to be confronted. A lot of this work is already being done through organizations like Operation Good Food and Beverages, which works to empower Black youth to recognize the history surrounding the food system and spark a good food revelation, or revolution and revelation. You recently conducted research on ethnically targeted marketing of unhealthy foods and beverages, Dr. Kumanyika, through this organization. What would you say is your biggest takeaway?
Well, first I'll tell you a little bit about the project that we did. It was really exciting, an opportunity to create a new approach to a really important food justice issue. The issue is the disparity created by the way unhealthy foods are marketed to Black communities and Black youth in particular, so that it exposes the youth, for example, to messages and settings that really promote unhealthy diets. So the typical approach to doing this is to talk about how companies victimize people and so forth. And we decided that while that approach may have its place, we wanted to flip the conversation to something positive and lift up the voices of Black youth as powerful consumers who were demanding healthier foods and beverages. And so we created this campaign called Operation Good Food and Beverages. We have a website, Instagram, TikTok, and a petition. The petition is to the National Restaurant Association to sit down with us and talk about the possibilities and realities of getting healthier food onto main menus, because teens and youth, they don't eat from the kids' menu, they use the main menu. Our biggest takeaway was that a positive message is really well received, even though people are skeptical that it can work. We feel that it can work when youth raise their voices and put it in their own words that they want healthy food and want to be to really have the marketing shift more towards the healthier foods and beverages. So we hope that Operation Good Food and Beverages will be the viable start for a long game in this way.
Thank you, thank you. And Ms. Turner, in your role as a school nutrition specialist, you have seen some of these issues come to the fore. What is it that you want to share with policymakers today?
One of the main things, I want to shift the view of what a policymaker is. We're all policymakers because we either vote for those who make policy or we vote for people that appoint people that make policy. So rather than focusing on, and it's very important to focus on all of it, but the focus is always the people in Congress or the people in those positions. Focus on your neighbor. Focus on the people you see every day. Focus on shifting the mindset, because the mindset is what causes people to vote the way they vote and choose the way they choose and have the view sites and sites they have on things. And it's all part of a cycle. It's not a vacuum. When we see certain perceptions and we see marketing and we see how things are portrayed in the media or in our neighborhoods, that is how we come to these conclusions, and that's part of our implicit and explicit biases. We come into these conclusions that, oh, the policy should be this because these people may not deserve this, because that's what we see and that's what we're surrounded in. It's capturing it right in the middle and stopping the cycle where it is and saying, maybe my perception is based on something other than reality, and let me think critically and then talk to my neighbors about what policy we want to make going forward.
Good, good, thank you. And Cam, as a young activist, what would you say has been the most important lesson you've learned about enriching your community from creating your own food-based nonprofit, KR Smoothies?
So I would say with my community work and the work that I've been able to do with KR Smoothies is, in order to convey these heavy messages, you have to really take the time to empathize with the people that you're trying to communicate to and be really intentional about the time that you are taking to connect with these people. Because if you don't understand them or meet them where they are, then you will not be able to convey that message to them. So just being really intentional about the space and time that you take up with the communities that you serve.
Awesome, thank you. Thank you. Wonderful, thank you, panelists. And with that, we're actually wrapping up our focus on obesity in the food system, moving toward our final focus area of environmental challenges, the pursuit of environmental justice. But before we do that, we're going to end with a word from Chef Jose Andres, who is not with us live, but actually who is on location in Ukraine with his team from World Central Kitchen. But we're going to end by hearing from Chef Jose Andres.
Hello, people of the Bloomberg American Health Summit. I am Chef Jose Andres. Thank you for being here today. The topic of food policy, equity, and health has never been more important to me, to America, and to the world. Food should be part of our lives to nourish our bodies and our souls, not to make our communities sicker. And food policy should have a positive impact in all communities, making sure that food deserts and food swamps become a thing of the past, making sure children in the schools have access to universal, free, healthy meals, enriching and revitalizing communities instead of leaving them hungry and poor. This past September, I was so proud to co-chair the White House Conference on Hunger, Nutrition, and Health, the first of its kind in over 50 years, where people from all walks of life, government, private sector, nonprofits, people with lived experiences from all parts of the country, came together to declare that food should be a national priority, not an afterthought. And that health and equity have a vital role to play in the future of how we feed our country and our world. Thank you to everyone involved in today's event, especially the Operation Good Food and Beverage Project, the Council on Black Health, Heart Smiles, and of course, the Bloomberg American Health Initiative. The conversations you have today will impact the work we all do tomorrow. And together, one plate of food at a time, I know we can create a healthier, more equitable America. Thank you very much.